ourselves. And I'm Dr. Travis. I'm here with Dr. Phillips. Dr. Chiro is going to be with us this evening, but we're here to teach you guys how to be healthy, right? And so, especially this time of day and this time of the year and this craziness we have going on. I don't know if y'all have ever looked at or tried to look up research or stats on anything, and we don't know what's good, what's bad. Like you read conflicting stats in the same, not a report, but an article, which is confusing. And so what we want to do is go through good research and teach you guys how to be healthy, because we're the unhealthiest species on the planet right now, guys, and we need to change that. And it's very simple, and it's through eat well, move well, think well. And the more we can concentrate on that and learn the specific things we need to do with that, the healthier we can be. And so we're going to break it down very simple for you and break it down one thing at a time. And today we're talking about vitamin A and D. And so Dr. Phillips is going to go through some research on that. So Dr. Phillips, why don't you teach him a little something?
Yeah, give me just a second here. I'm going to share my screen with you guys. There we go. All right, so let's start here at the beginning. What we're going to be looking at today, guys, is some of the research on the balance between vitamin A and vitamin D. We know that there are a ton of benefits to vitamin D. So what we're going to look at is a systematic review of all the research that is there on vitamin D and why it's important that we have the right levels of vitamin A along with vitamin D, because they actually work synergistically together, which we'll get into. But first, like Dr. Travis was saying, this is our 12 minutes to health, and this is what we do every Tuesday for you guys. We come with a new topic dealing with either eating well, moving well, or thinking well. And it's our commitment to you guys that we provide you with the best research out there. We want to use peer-reviewed randomized controlled trials or reviews of other randomized controlled trials like we are today, so that you get not just our opinions and not just our beliefs or things like that, but you get the facts and what's actually going on with the science of how to be healthy and what it takes to commit to that. So we want to give you this unbiased, evidence-based approach every week, because the truth of the matter is there's a lot of companies out there that do their own research, right? And that's what Dr. Travis was saying about the articles and things of that nature. And it's marketing, it's advertising, it's not randomized controlled trial research. So what we want to do is give you an unbiased look at what the actual science says out there. So tonight, like I said, we're going to be focusing on the importance of a balanced approach to vitamin D supplementation. So vitamin D, everyone, it's been in the news, social media, things like that quite a bit here recently because of how it supports your immune system. But that's not the whole story. Okay, see, vitamin D does help the immune system. But without vitamin A, it doesn't help the immune system at the level it could, and it doesn't help the immune system at the level that we require. All right, and it's more than just the immune system as well. I mean, as you're going to see as I go through this research, it is important in absolutely everything that happens in our body, from our brain to our heart to our pancreas to our liver to you name an organ, a system in our body, and vitamin D and vitamin A are huge players in it. So we'll get into that. The reason that we look at vitamin A and vitamin D and being balanced is because so much in healthcare right now, there is in the allopathic model, there's a symptom, one pill for one symptom approach, right? There's a symptom, let's take care of it with this one pill. And right now we're looking for that one magic pill. And they just don't exist. And what the research shows us about health is it's important to stay balanced. And that's why we are consistently talking about eating well, moving well, and thinking well. Right? And even when we talk about eating well, there's not one superfood. There's not one thing that you can eat that you're going to be healthier than if you eat something else. There's a balance that has to take place in our body. We are trying to reach homeostasis, like we always talk about, or baseline health and immunity. So in order to do that, the research points us to being balanced throughout our nutrition, balanced with our exercise, like we've talked about in weeks past, and also balanced in our social settings and how we're thinking and how we're dealing with stress. So when we look at the balance of vitamin A and vitamin D enhance each other. They do so through RXR receptors, which really isn't that important, but what's important is that they talk to each other, these two vitamins, A and D. So they work together, they use the same receptor sites, and they actually enhance the other's ability to be able to bind to these receptor sites. So it's hugely important that we have both of them in our system. So if vitamin A or vitamin D is being supplemented correctly on one side, but the other one isn't, then you're going to create what they call a functional deficiency. You're going to have too much of one versus the other, and you're not going to be in balance, and you're not going to see the benefits from them. And they started noticing this because in this article or this research review, they looked at all these different research studies that had been done, and they saw some where vitamin D was used alone and there was some benefit. Vitamin A, there was some benefit. A and D used together, there was huge benefit, especially when it was used over time, like we've talked about in the past, consistently in small doses that are appropriate for our species. So vitamin D, when they do certain studies, they'll do like 500,000 IUs in one sitting, and then study that over the next year, and they see detrimental effects to it. It doesn't work the way it should for a couple of reasons. One, our body can't handle all that at the beginning. It needs to be consistent so that it can build up in our system. And two, it needs vitamin A because they work synergistically together. They need to be used together in a balance. So when we look right now, low levels of vitamin D, vitamin A, and other carotenoids are correlated with a greater risk of heart disease. This is a huge one with the vitamin D and vitamin A studies because we just don't get enough of either in today's culture in the United States, right? I mean, if you look at it, we're indoors way more than we ever were. We wear more clothes than we ever did before as we were evolving. We have less sunlight, we have more pollution, all that kind of things. Foods with vitamin A in them are hard to get. You know, we're looking at wild caught, wild fatty, oily fishes, right? That's why one of the best places we can get it, which we'll talk about here in a second, is in cod liver oil. That's one of the best places that A and D occur in the correct amounts for our species. It's great for us to take that, and that's where the supplement should come from. But also things like getting good quality eggs, grass-fed, grass-finished butters, things like that that have vitamin A. It's a lot of fattier foods, and a lot of people don't like to eat that stuff, and we're just deficient in them right now. So that is actually leading to a greater risk in heart disease. We're not getting the right fats and the right fat-soluble vitamins like D and A in our system. So it's a really big deal. And if you look at A and D together, when they're in appropriate amounts, this study went on to show that the right amounts reduce cancer, they reduce heart disease, they clean up the liver, they help protect the bone density that you have. I mean, like I was saying earlier, every single system in your body is affected by vitamin A and vitamin D. And if you look back at that very first slide that I showed, I circled here for you, omega A and D sufficiency, right? That's the supplement that we sell in our offices because it's the only place that a fish oil is combined with a cod liver oil so that we have the appropriate balance of vitamin A and vitamin D so that our bodies can function optimally. That's how we help people reach homeostasis and baseline health and immunity. So that's a big, big deal for us. And the research is clear. That's what we need to be doing. So when it comes to eating well and you're looking at vitamin D, if you're not taking vitamin A, realize that you're doing yourself a disservice and you're going to have a surplus of vitamin D, which will create a functional deficiency. So as always, guys, we have this research in the office for you. Please stop in and come and grab it. We have the research articles itself. We have summaries of it. You can sit and talk with us about all of it. But it's hugely important that you come in and see us. And like we always talk about, and I'm going to let Dr. Travis tell you about what charity we're working with again this month. So take advantage of it. Don't just sit back and have the information. Go out and use the information and become healthy and help yourself and let us help you become healthy. Doc, you want to tell them about the charity that we're working with right now?
Yeah, absolutely. And before I get there, I know I haven't got the questions there yet, Chris, but I know I'm going to get the questions of how long is a long time, sustained for a long time, and how much vitamin D per day should they be taking?
Right. So you want to be between 4,000 and 5,000 IUs or international units of vitamin D a day. Most of the studies point to 4,000, but a lot of people are speculating that 5,000 may even be a little bit better. So we try to keep it between there. And that's the great thing about cod liver oil is it falls right in that optimal zone for our species, right? So it's honestly, it's the best supplement in the world. And that's why I chose to use it in the office and we choose to use it in our offices now, right? So, and if you're looking at at time it takes to build up, due to human physiology and metabolism, it's usually about 90 days. So, and that's got to be 90 days of consistently taking the correct amount of cod liver oil and omega-3 fish oil as well. So that's a good question. And yes, you will get it. And that's the right answer. So
yeah, it's really good stuff, guys. It's in liquid, it's in capsules. Call us if you have any questions, and then we'll get it over to you. But as always, we always work with our charities. And so we're on Big Brothers, Big Sisters right now. And our goal is to help and educate as many people as possible, and obviously help them out in the office. And so it's just a $39 donation, guys, for exam, consultation, x-rays. We do a spinal health assessment that gives you an overall, baseline health score in the office to see how we're going and how everything's doing. So give us a call, email us, Facebook us, however you want to contact us. Just shout out us and let us help. And if you know anybody that we can help as well, give them our phone numbers. They're here on the screen. They're also online. And then that's all I got for you guys today. And what are we talking about next week, Chris?
yeah, so next week, let's see here, on Tuesday, we are diving into one of the best chiropractic studies that's ever been done on how effective it is and how it compares to usual medical care. So that'll be a good talk next Tuesday for sure.
Yeah, that's a good one.
Yeah, absolutely. So, but before we head there though, I want to challenge you guys real quick, take this information you got tonight and pass it on to someone just one person. That's all we're asking. Just pass them the information, someone that you think maybe could be a little healthier, someone that you think could use the information, and tell them to get a hold of us so we can help them out even further. I know that this information has been invaluable for our patients and our families, our extended families. It's been incredible when you start to follow the research and what it actually says, how simple it can be to actually be healthy. So pass this on to someone, like it, share it with people, and we'll see you next Tuesday.
Hey guys.
Yeah, thanks.